Okay, we've got a food safety alert that you really need to hear about. The CDC is looking into a multi-state salmonella outbreak, and guess what? It's linked to something that could be sitting in your refrigerator as we speak. So let's jump right in so you know exactly what to look for and how to keep yourself safe.
First up, the numbers. As of the very latest report from the CDC, we're looking at 95 confirmed cases of salmonella infection directly tied to this outbreak.
And get this, those 95 cases aren't just in one place. They are spread out across 14 different states, which just goes to show you how fast and far a contaminated food product can travel.
So, what's the source? What's causing all this? It's something millions of us use every single day. Eggs. Yep, a specific batch of recalled eggs has been identified as the link here. We're going to get into the exact brands and codes you need to look for right now.
Okay, this is probably the most important part of this whole thing. It is time to go check your fridge. Seriously. Let's walk through exactly how to spot these recalled eggs.
So go ahead and grab your egg carton. You're going to look for one of these three brand names: Nagatoshi Produce, Misuho, or Nijiya Markets. But the real key here, the most important identifier, is the carton code. You're looking for CA7695. If you see that code, the next step is to check the sell-by date. If it's anywhere between July 1st and September 18th of 2025, it's part of this recall.
And just to get even more specific for you, the product itself is large, brown cage-free eggs. They're often marketed with names like Sunshine Yolks or Omega-3 Golden Yolks. The distributor is a company called Country Eggs LLC, and they were mainly sent out in California and Nevada between the middle of June and early July of 2025 to both regular grocery stores and restaurants. All right, so now that you know exactly what to look for, let's talk about why this is so serious. Understanding the risk of salmonella is absolutely key to protecting yourself and your family.
So what exactly is salmonella? Well, it's a type of bacteria, and it's one of the leading causes of what we call food poisoning. Now, once someone gets infected, the tricky part is that symptoms can show up anywhere from just 6 hours later to almost a full week later. That delay can make it really hard to figure out what made you sick.
So here's how a typical infection usually plays out. After you're exposed, you'll start to feel those telltale symptoms. We're talking diarrhea, fever, and stomach cramps. Now, for most healthy folks, the illness just kind of runs its course in about a week. But for some people, it can get much more severe and even land them in the hospital.
And this is so important, knowing the difference between a standard run-of-the-mill case and the major warning signs. So most people will just get the symptoms you see on the left. But if you see any of the symptoms on the right, especially that high fever over 102, or diarrhea that just won't quit, or signs of dehydration, that is your signal to call a doctor right away.
It is also absolutely critical to know who is most vulnerable here. We're talking about young kids under 5, older adults 65 and up, and really anyone who has a weakened immune system. For these groups, an illness that might be mild for someone else can turn into a very serious medical situation, and fast. Okay, so we've identified the product, we understand the risks. Now let's get to the final part, the official action plan. Here are the crystal clear steps the CDC is recommending you take, like right now.
This is your simple 4-step plan. Number 1, check your eggs using all those details we just went over. Number 2, and I can't stress this enough, do not eat them. Third, either throw them straight in the trash or take them back to the store for a refund. And finally, and this is crucial, you have to thoroughly wash any counters, cutting boards, fridge shelves, or utensils that could have touched the raw eggs. Don't skip that last step.
And of course, the advice for businesses is just as direct. If you're a restaurant or a grocery store, you absolutely must not sell or serve these recalled eggs. And just like at home, you need to do a complete wash and sanitation of any surface the eggs might have touched to prevent any cross-contamination.
And look, this isn't just some friendly advice. This is the official word coming straight from the U.S. Centers for Disease Control and Prevention. Their message could not be more simple or more clear. Get these eggs out of your house and out of the food supply. Period.
It's pretty wild to think that this entire outbreak, all those cases across all those states, started from just a single source. It's a really powerful reminder of how important food safety is every single day. So it kind of leaves us with a question to think about. After hearing all this, what's the one food safety rule you'll never, ever skip again?